Hi everyone, today we're going to be talking about Rett syndrome. Rett syndrome, or RTT, is a rare genetic neurological condition occurring primarily in girls. It is usually diagnosed between 6 and 18 months as a child begins to miss or regress in developmental milestones. Symptoms may range from mild to severe, and they have three clinical presentations: classical, atypical, and male RTT. Symptoms may include slowed growth of the head and other body parts, loss of normal movement and coordination, particularly the loss of functional use of hands, loss of speech, agitation, repetitive hand movements like hand wringing are often a hallmark sign of RTT, and those with RTT may also suffer from seizures, GI tract, and cardiorespiratory difficulties. RTT is caused by random mutations on the X chromosome, most often on the MECP2 gene. This mutation causes problems with protein production critical for brain development, and it's very rarely inherited, and there are no known risk factors as it occurs randomly. It occurs across all racial and ethnic groups. It occurs about in 1 in 10,000 female births and even less in males. Life expectancy is often middle age or older for girls, but boys typically die before or shortly after birth due to it being an X-linked disorder. And the most frequent cause of death is sudden death related to cardiorespiratory compromise. There's no cure for RTT, but there are treatments targeted to improve symptoms and encourage occupational participation, like specialty medical care, PT, OT, speech therapy, and medications to target side effects. However, these interventions may be lifelong and can be very expensive. So people with RTT will often take medications for relieving agitation, their cardiac issues, seizures, and GI tract issues. And across the board, side effects may include nausea, fatigue, insomnia, poor concentration, depression, and diarrhea. So some precautions you want to be aware of: some symptoms may be hard to distinguish from typical RTT symptoms, such as agitation and seizures, and it may be hard to distinguish between typical symptoms and indicators of pain. Breathing and heart rate need to be monitored, as they can lead to serious complications. And hand and oral stimulation may also lead to self-injurious behaviors and damaged tissue due to hand biting or hand wringing. If severe, RTT can affect nearly all areas of life and impair ability to speak, walk, eat, breathe, and have functional use of the hands, so they may require assistance with ADLs, often throughout the lifetime, and this can lead to caregiver burnout. OTs primarily work on promoting feeding skills and functional use of the hands. However, those with RTT can continue to learn and take part of community and home activities throughout their lives. They can learn to feed themselves, use alternative communication devices, and they can express their full personalities and often enjoy company and affection from others.